announced the suspension of all contact sport activities earlier this week. The department says the decision is a result of the increasing COVID-19 infections across South Africa. Non-contact sports training in schools will continue, provided all safety measures are observed and there is no physical contact between participants during training. But what impact does this decision have on the physical development for children? What is the impact as kids are already less active as a result of COVID-19? For more on this, we're now joined via Zoom by Dr. Moshe Magethi. He is a sports physician. Doctor, thank you for being with us. First up, do you agree with this decision or not?
Good afternoon, Francis. Thank you very much for having me, and a good afternoon to your viewers as well. I think what you see here is the Department of Education trying to strike a balance between continuing physical activities at school and also curbing the spread of COVID-19. So I wouldn't say I agree or disagree, but the positives I take from it is they didn't completely stop exercise and sporting activities at school, but they've tried to strike a balance between curbing the spread of COVID and also, continuing sporting activities.
So let's look at what will stop. Presumably things like soccer, hockey, netball, a lot of those team sports that bring children together. Do you think that has a serious impact, or can it be offset by at least, okay, they can get onto the running track or something like that?
Yeah, so in general, when you look at the physical activity levels of our children in South Africa, they are not where they should be. But the Department of Basic Education can be wise, or they can be innovative in that they don't have to, for example, necessarily stop something like a soccer, a rugby, a netball. They can just prevent contact from taking place. And for example, in rugby, you can have passing drills, you can have running drills, you can do the same in soccer, you can do the same in netball, as long as you keep social distancing, which is a minimum of 1.5 meters between the athletes, and you continue the sporting activity. So
that would be your advice to schools. It sounds like a good idea. You still keep the practice, you just do non-contact activities, but you get the kids out and they're still active.
100%. So they were wise in saying that they are preventing contact sport, which is understandable. Mm-hmm. But you can still, and you'll remember, I don't know whether they specifically said certain sports, but if you, for example, look at rugby, as I said, you can still have passing drills. You can still keep a 1.5 meter distance between the athletes without necessarily going into contact. So in that case, you can still be physically active without necessarily going into the risk of spreading COVID.
We do know, I mean, during that hard lockdown, remember, people weren't even allowed outside of their yard. Sometimes families stuck in very small areas, in shacks. The kids, very little movement. They couldn't even play with other kids. It was a terrible time. Are you worried about the long-term impact of inactivity for those children?
Yeah, so that's actually a good point. When you there's HACSA 2018, which was published. It's a report card regarding the physical activity levels of children in South Africa, and they showed that the physical activity levels in our country are actually low. In a study where 12 countries were kind of, how can I put it? They were studied. South Africa was one of the 12 countries, and they found that we had the least physical activity levels. Yeah. Now, this brings about a certain level of risk, mentally and emotionally. It brings about a certain level of risk physically as well. We are seeing things like diabetes, obesity, hypertension being diagnosed among children, and it is a challenge. So I think the Department of Basic Education plays a very important role in ensuring that our children remain physically active.
Why were we so low? I mean, that's even before COVID-19. It sounds like we were lagging behind many countries. Why?
Yeah, so this is actually even before COVID. So you can imagine the impact it has had now that we are in COVID. They found that there are different reasons. So the first one being screen time. With the increase in tablets, cell phones, TV, etc., we are seeing a lot of our children spend too much time on these gadgets, number one. Number two, they found that in low socioeconomic areas, things like access to sports parks, access to parks, and even safety were a big concern. So, for example, a parent will be concerned that a child can't cycle or walk to school, which would improve their physical activity levels, or they cannot play outside because it's not safe. And then, of course, the physical education in our public school has gone down. In our public schools, they have gone down. So
all right, we seem to have lost him there. We've lost your sound. That was Dr. Moshe Magethi, sports physician, but we got the gist of the issue here. Sporting activity, physical activity, so important for children. We were already lagging before COVID-19, saying at least the education department trying to reach a balance now, saying some activity is allowed as long as it's not a contact activity. That was Dr. Moshe Magethi, a sports physician. Let's leave it there.